So we will now study about the food poisoning in microbiology. Okay. Now see, first organism which causes food poisoning is Bacillus cereus. Bacillus cereus. And what is the common name of the illness of the which causes Bacillus cereus food poisoning is Bacillus cereus food poisoning. And you can see that the onset time after ingesting these Bacillus cereus is 10 to 16 hours. And what are the sign and the symptoms? Sign and symptoms are the abdominal cramps and watery diarrhea and nausea. Okay. Then the duration, how much time this Bacillus cereus food poisoning will occur? It's 24 to 48 hours. And what are the food sources for these? Are meats, gravies, vanilla sauce, and stews. Okay. So this first organism is Bacillus cereus. Second organism which causes food poisoning is the Campylobacter jejuni, and the common name for the illness is the Campylobacteriosis. And you can see that the onset timing after ingesting the food with Campylobacter jejuni is the 2 to 5 days. It takes long, approximately 2 to 5 days to for the onset of the disease. And what are the signs and symptoms? The normal diarrhea. It also causes cramps, fever, and vomiting. And diarrhea may be bloody. In this cases, Campylobacter jejuni, diarrhea may be bloody. And you can see that duration is 2 to 10 days. And what are the food sources? You can see that raw and undercooked poultry, okay, and unpasteurized milk and contaminated water. This unpasteurized milk is one of the very important for the Campylobacter jejuni. Now you can see the Clostridium botulinum. Clostridium botulinum, this causes botulinism, and you can see that the onset timing is for 12 to 72 hours. And what are the signs and symptoms for this Clostridium botulinum? Vomiting, diarrhea, blurred vision, double vision, difficulty in swallowing, muscles weakness. It can also result in the respiratory failure and death. So botulinism is one of the very serious emergency conditions in food poisoning. In duration for the of the period of the illness is variable. And what are the examples for this? What are the food sources which causes this food poisoning of botulism? Is the improperly canned food, especially home canned vegetables, fermented fish, baked potatoes, aluminum foils. Means whatever the canned foods that comes, that causes botulism. Okay. Next organism is Clostridium perfringens. You can see that perfringens food poisoning इसको बोलते हैं. These are called as perfringens food poisoning. And what are the onset time after ingesting is the 8 to 16 hour. And sign and symptoms are intense abdominal cramps, watery diarrhea, and the duration is usually 24 hours. Okay. What are the food sources? Yeah, meats, poultry, dry or pre-cooked foods, time and or temperature abused foods. Okay. Means that kind of foods which are preserved for the long periods. They are time and temperature abused food. Then next organism is Cryptosporidium. Cryptosporidium causes intestinal cryptosporidiosis. The onset timing is 2 to 10 days. Diarrhea, usually watery diarrhea, abdominal cramps, upset stomach, and slight fever. Duration is variable, and you can see the undercooked food contaminated by ill food handler after cooking contaminated drinking water. Okay. Next organism is Cyclospora Calcaneus. This causes cyclosporiasis. You can remember Cyclospora has the onset of time after ingesting is 1 to 14 days. Usually at least 1 week it takes. And this also causes diarrhea, loss of appetite, substantial weight loss, abdominal cramps, nausea, vomiting, and fatigue. It may be remitting and relapsing after weeks to months. Okay, it's a various types of fresh produce such as imported berries, lettuce, and basils. These imported lettuce, berries, these are used in burgers. So you can see that burgers can cause cyclosporosis. E. coli bacteria. You also know that E. coli produce toxins. So this will E. coli is the common cause of travelers diarrhea. You can remember this. And the onset timing is 1 to 3 days. Watery diarrhea, abdominal cramps are the symptoms. It takes 3 to 7 or more days to produce the symptoms. And what are the source of food? It is water or food contaminated with human feces. And then E. coli with a strain O157H7. This is the causes hemorrhagic. This is causes hemorrhagic, means bloody diarrhea. Okay, it has the onset timing 1 to 8 days, and you can see that there are severe. This is severe diarrhea causing often bloody, abdominal pain and vomiting. Usually little or no fever is present. It is more common in the children of the 4 years. You can mark this, or younger. It can lead to kidney failure also. And you can remember the Shigella like toxin which causes uh, HUS, that also caused by E. coli O157 and H7. And the duration is 5 to 10 days, and it comes in the undercooked beef, especially hamburger, and unpasteurized milk and juice, raw fruits and vegetables, for example fruits, and contaminated water. Then the organism which causes food poisoning is hepatitis A. It's associated with hepatitis disease, and the day of onset is 28 days, average 15 to 50 days. It causes diarrhea, dark urine, jaundice, and flu-like symptoms, that is fever, headache, nausea, and abdominal pain. And they are variable to 2 weeks to 3 months. The raw produce contaminated drinking water, यानी कि undercooked foods and cooked foods that are not reheated after contact with an infected food handler, and shellfish from contaminated water. Okay, so these causes hepatitis A. Then another important organism is Listeria monocytogenes. Listeria monocytogenes, you know that Listeria monocytogenes can survive in less temperature, means फ्रीज में भी ये सर्वाइव कर सकते हैं. Listeriosis, this causes listeriosis. Okay, so the what is the onset timing? It is 9 to 48 hours for the gastrointestinal symptoms, and 2 to 6 weeks for invasive disease. So this can also invade in the bloods, so it causes invasive disease. What are the symptoms? It causes fever, muscle aches, nausea, vomiting. And pregnant women may have mild flu-like symptoms, and an infant can cause and the it can also cause premature delivery of the infants, okay, or a stillbirth. So when the elderly are immunocompromised, they can develop bacteremia or meningitis. So Listeria monocytogenes is also a cause of meningitis. Okay, duration of illness is the variable, and it also you can see that it is also found in the food sources of unpasteurized milk, soft cheese made with unpasteurized milk, or ready to eat daily meats. Okay, then the noroviruses. Noroviruses are variously called viral gastroenteritis, or can cause winter diarrhea, acute non-bacterial gastroenteritis, food poisoning, and food infection. What is the onset timing for noroviruses? 12 to 48 hours. And you can see that symptoms are nausea, vomiting, abdominal cramping, diarrhea, fever, headache. Diarrhea is more prevalent in adults, vomiting more common in children. And 12 to 16 hours, 60 hours it takes. And raw produce, contaminated drinking water, uncooked foods, cooked foods that are not reheated after contact, infected shellfish. Okay, then salmonella. Salmonella is one of the cause of food poisoning. So it causes salmonellosis, and the onset timing is 6 to 48 hours. It has the symptoms of diarrhea, fever, abdominal cramps, and vomiting. Okay, and the onset duration of the disease is 4 to 7 days. You can see that eggs, poultry, meat, unpasteurized milk or juice, cheese, contaminated raw fruits and vegetables are these are the or food sources which causes salmonellosis. You have the Shigella. You can see that Shigella has the shigellosis or bacillary dysentery. It causes shigellosis or bacillary dysentery, and it takes 4 to 7 days for the onset of the symptoms. And what are the symptoms? Abdominal cramps, fever, diarrhea, and a stool may contain blood and mucus. So when you see that bloody diarrhea, it is seen in the cases of hair, Shigella, and you can remember that E. coli O157H7 also causes bloody diarrhea. Okay. Then what is the duration for this shigellosis? Duration of disease 24 to 48 hours. And what are the food sources that causes shigellosis? Is raw produce, contaminated drinking water, uncooked foods, and cooked foods that are not reheated after contact with an infected food handler. Okay. Then one of the very common causes of food poisoning is Staphylococcus aureus. you can see that Streptococcus is very common. Streptococcus aureus has the streptococcal food poisoning, the common name for the disease, and it you can see that how uh, small the timing for the onset. It usually occurs in 1 to 6 hours. So if a person eats a food and he develops abdominal symptoms or vomiting, diarrhea in severe nausea and vomiting, abdominal cramps, diarrhea or fever in 1 to 6 hours, then it may be case of streptococcal poisoning. And the onset of duration of the disease for the 24 to 48 hours. They are the salmonella and the streptococcus are present in the unrefrigerated or improperly refrigerated meats, potato and egg salads and cream pastries. Okay. Then the Vibrio parahemolyticus, which causes Vibrio parahemolyticus infection. The onset of duration is 4 to 96 hours. Watery diarrhea this causes. Occasionally they may cause bloody diarrhea. Abdominal cramps, nausea, vomiting and fever. The duration of disease is 2 to 5 days and undercooked raw or seafood such as shellfish. Then Vibrio vulnificus. They have the onset duration 1 to 7 days, and you can see that it causes bloody diarrhea. It causes blood-borne infections, abdominal pain, vomiting, fever, bleeding within the skins, and ulcers requiring surgical removals. It can be fatal with person with the liver disease or weakened immune system, and the duration of disease is for the 2 to 8 days, and it are found in the Vibrio vulnificus is found in the undercooked or raw seafood such as shellfish, especially oysters. Okay, so these are the organisms which causes food poisoning